Germany for the last decade had experienced a horrible depression coming out of World War I and was crippled by the debt imposed by Great Britain and the other Versailles powers. The hyperinflationary blowout that occurred in 1923 shocked the people of Germany. Homelessness was rampant, malnutrition was commonplace, and state resources had become scarce for this increasingly impoverished population. The only way to turn this gruesome economic picture around, they thought, was to cut off the fat. The target was healthcare. It started off small. At the National Socialist Party Congress in 1934, Nazi doctor Gerhard Wagner declared that the economic burden represented by people suffering from hereditary diseases is a danger for the state and for society. In all, it is necessary to spend 301 million Reichsmarks per year for treatment of these patients, not including the expenditures of 200,000 drunkards and about 400,000 psychopaths. This was unacceptable to the Nazis. That same year, comparative cost-effectiveness tests invaded schools, where students were brainwashed with textbooks to get them to think not of human value, but monetary value. Here's an example. Problem 97. A mental patient costs 4 Reichsmarks each day. A crippled person costs 3.5 Reichsmarks per day. In many cases, a civil servant earns only 4 Reichsmarks a day, an office worker barely 3.5 Reichsmarks, and a literate worker less than 2 Reichsmarks per family head. A. Analyze these figures on the basis of the fact that in Germany there are 300,000 mental patients in the institutions. B. On the basis of 4 Reichsmarks each per day, what is their total cost each year? C. How many marriage loans of 1,000 Reichsmarks could be obtained each year with this money? By October 1939, Hitler issued a decree, which he wrote in his own hand, backdated to September the 1st, the day the Nazis invaded Poland. In preparing it, he stated that he considered it proper that the life unworthy to live of severely mentally ill persons be eliminated by actions that bring about death. Hitler later noted, in this way, a certain saving in hospitals, doctors, and nursing personnel could be brought about. The title of Hitler's order was The Destruction of Lives Unworthy of Life, the Useless Eaters Policy. It read, Reichsleiter Bühler and Dr. Brandt, M.D., are charged with the responsibility of enlarging the authority of certain physicians to be designated by name in such a manner that persons who, according to human judgment, are incurable can, upon a most careful diagnosis of their condition of sickness, be accorded a mercy death. But this was only the first step. Under Hitler's decree, the incurable came to include all those who were unable to carry out mechanical work, those with schizophrenia, epilepsy, mental retardation, paralysis, senile disorders, and those who were not German citizens or of German-related blood. So the executions did not begin at Auschwitz or Buchenwald, but in gas chambers in the hospitals. Patients who were incurable were asked to fill out questionnaires, then quickly carted off to euthanasia institutions like Hadamar, Hartheim, and Grafeneck, where by the late 1940s, over 100 so-called mercy deaths were given daily, without the consultation of patients or their families. So much for Hitler's careful diagnoses. Healthy Jews were exterminated without examination. This program became so regular that standard text notices were sent to families of euthanasia victims, sometimes a year after they had been murdered, along with urns of, presumably, the family members' ashes, and a bill from the insurance companies for the care given. With the support from London and Wall Street, the Nazis were now fighting a two-front war and devoting vast German resources to destroying the enemy. And so the Nazis took the useless eaters policy to the extreme. Those who were not immediately put to death were used as subjects in medical tests, not to advance medical knowledge, but as admitted by the Nazis during the Nuremberg trials. The true object of these experiments was how to destroy and kill. And when they sought government funding for the tortures, Dr. Karl Brandt and others issued it, on the grounds, of course, that the Nazi doctors had access to human material not available to other agencies. They had the subjects for the sterilization experiments. The prisoners at Buchenwald shot with poisoned bullets were guinea pigs not to test an antidote for the poison, but to determine how quickly the poison would kill. Or the high-altitude experiments where the Nazi doctors just wanted to see what would happen to a live human in a pressure chamber. The result of Hitler's decree amounted to at least 100,000 Germans put to death, 70 to 80,000 patients in medical and nursing homes, 10 to 20,000 invalids and disabled people in prisons, and 3,000 children between 3 and 13 who needed special care. In addition to all this were the millions of Jews, gypsies, and other undesirables who were killed or worked to death in concentration camps. Did the Nazis actually cut the cost of health care? Probably, but at what price? President Obama has just revived the Hitler program. Ever since his trip to London, the Obama administration has been revealing more Hitler-like policies. But remember, Obama would not be the first personality manufactured by the British. On May 11, 2009, President Obama unveiled his plans to cut health care, like Medicare, by $2 trillion over the next decade, with the help of a team of Nazi doctors, which he says is an attempt at cutting health care costs. The team preparing to execute this is the Coordinating Council on Comparative Effectiveness Research and centers around OMB Director Peter Orszag. Rahm Emanuel's brother, Ezekiel Emanuel, a leader of this team, and advisor to Orszag, has proposed euthanasia for the elderly, cancer patients, and the terminally ill, or the incurable. Behind this is the doctrine that human life can be sacrificed to reduce costs, as a group around Obama has brought back the cost-effectiveness research questionnaires to validate mass murder. Sound familiar? But even worse, at the May 12th roundtable discussion on financing healthcare reform, U.S. elected officials discussed how to push through a drastic reduction in healthcare. They proposed the adoption of the British model. A regulatory agency would be set up to ensure that no doctor give too much care to a patient who isn't worth the cost, and if the doctor did, consequences would ensue. Lifestyle taxes were also proposed. So if you're handicapped and can't get good exercise, or if you make minimum wage and can't afford to eat organic groceries, that will determine whether or not you are fit to receive care. This is not hyperbole. This is the Hitler program. But it always starts small. Obama has adopted the Hitler program, and when the President of the United States adopts that program, that's the time to unleash. The first step to defeating this policy is to repeal the HMO system that makes all of this possible. Otherwise, Obama's $2 trillion solution may be the final solution.